Hello everyone. Today marks World Tuberculosis Day, a day celebrated annually on the 24th of March to create awareness about tuberculosis, commonly known as TB. TB remains a serious public health condition in many countries, including Ghana. But the good news is that TB is preventable and curable, especially if detected early. This year, the theme for the celebration is Yes, we can end TB. And to help us understand what we can do to stop the spread of tuberculosis, I'm joined by Dr. Bernard Ziem, the program manager for the National Tuberculosis Program under the Ghana Health Service. My name is Zano Billy, and this is the Good Life Chat Room. Stay tuned. Dr. Bernard Ziem, you're welcome to the Good Life Chat Room.
Thanks for having me.
To begin with, why is the 24th of March important in the fight against tuberculosis? And what does this year's theme, Yes, we can end TB, mean for countries like Ghana?
So the 24th of March 1882 was the day Robert Koch announced the discovery of Mycobacterium tuberculosis, the germ that causes the disease TB. Yes, we can end TB, powered by the people, led by countries, is this year's theme, and it declares the commitment of Ghana to the UN declaration to end TB by 2030. And Ghana joins the global community to commemorate this day as part of our efforts to end TB.
So for someone who may not know much about tuberculosis, can you tell us what tuberculosis is, how it spreads, and who is most at risk of getting it?
So tuberculosis is a disease caused by the germ Mycobacterium tuberculosis. It is spread by droplet infection from person to person when they cough, sneeze, or talk. Every person is at risk, but of particular high risk are persons infected with HIV, persons involved in mining works, persons who have poorly controlled diabetes, persons who are contacts to TB cases, and then children, as well as any person who is in a state of depressed immunity, like chronically ill cancer patients, and then those who dwell in poorly ventilated homes, like prisoners and slum dwellers, are particularly at higher risk.
I was going to ask you about children, but you've already touched on children. But can you tell us what are some of the warning signs when it comes to tuberculosis? And then elaborate a little bit more about the children, especially for children who live with caregivers or parents who have tuberculosis or live in some of these slum communities, since you already mentioned that they are at an increased risk.
Okay. So the cardinal signs of TB, signs and symptoms of TB are cough, fever, weight loss, night sweats, and chest pain. For contacts or persons living with known TB patients are at high risk, and children particularly should be screened for TB because of their immune status. They are generally not mature in their immunity.
So that means that for some of my patients who are losing weight unprovoked, they should also get screened for tuberculosis.
Weight loss is a predictor of TB.
Yeah. Before we go on, let's go onto the streets and find out what Ghanaians know about tuberculosis. We'll be right back.
Hello everyone, today is World Tuberculosis Day, so we took to the streets of Accra to ask people what they know about TB. This is Good Life Chat Room, Street Vibe Edition. My name is Odra Bwajua Agnes. Stay tuned. But what is TB pen?
Mate.
Where then?
I think area.
Okay, then Emma Wunya TB.
Oh, and the we're doing dim and now say yes, we're doing dim. And then
Okay. Yeah, that's
okay.
Do you know tuberculosis?
Yeah, actually, I know it's a sickness that's normally caused somehow.
What kind of sickness?
It's a sickness that normally affects, it makes you feel in a way that I see, like you feel too cold. It's also similar to malaria, but just that a little bit different out of
That's tuberculosis
yeah,
for you.
please.
Okay.
Tuberculosis.
And I win.
Maybe me so we are not ready.
Okay.
Yeah.
But what did you say? Obi echia obetimi anya bia na.
I can't relate around that because yeah, I'm ready.
Do you know about tuberculosis?
TB. Well, I know about TB, but TB itself, because I've never experienced TB, I can't tell you much about it.
But do you know how it looks like if you have TB?
I think TB does it come with cough or you find
Ocho, what is TB pain?
yeah, tuberculosis. Yeah, but I don't know the cause of near mediba.
Now why test ni be pain?
That be
Oni mo bia wanya be pain.
no. That be.
O did say obi na na chia obenya bia na.
And say fiana mi boy.
Okay.
You know tuberculosis? What is it?
It's a disease,
What kind of disease?
a health disease.
Okay, David.
And with the tuberculosis, I've not read much about that, but I think I read a story about that, and it's a water something, but I've not really go it's all about yeah.
Okay, King David.
Yeah, actually, tuberculosis is an infectious disease. You can get it through an infected person. And when you get it, the same thing is you cough blood and there'll be blood in your lungs and those kind of things. So it's an infectious disease. If someone is affected with the person coughs in the air, you can get it through that. Or maybe touching things that the person has already touched, which the things have been infected by the bacteria. So that's what I know.
Very good. Why can you more?
Ocho, what is TB pain?
Tuberculosis. Mati some kakra about me say that follow sir.
Why you want test pain?
There be.
Oni mo bi nso wanya bida.
There be.
Oh, okay.
In the community, if we suspect that someone has TB, what are some of the steps we can take to get the person treated? And what can you tell us as Ghanaians about the treatment of tuberculosis in Ghana?
A person who presents with cough, fever, weight loss, and night sweats is presumed to have TB. So, if a person is suspected or presumed, you have to go for screening, and it is done in health facilities or sometimes in the communities through outreaches. When a test is required, the person has to give sputum sample or some other body fluids for testing. In some situations, we also take chest x-rays, and if there are abnormal findings, a radiologist can judge clinically and confirm TB in the person. When a person is confirmed, he or she will be put on treatment. The duration of the treatment for drug-susceptible TB is 6 months. The one for drug-resistant TB is about 6 to 9 months. It can also be longer depending on the response to the person whilst on treatment. Let me state that TB testing and treatment is free and is available in public and private facilities across the country.
What I get from what you said is that if someone is confirmed of having tuberculosis, the person can get treatment either in a private health facility or in a state-owned health facility for free. X-rays, labs included, everything for free. Is that what you are saying?
Yes,
Okay.
generally free.
So we've all heard it from the program manager's own mouth. What he's saying is that whether you go to a private facility or to a state-owned health facility, treatment for tuberculosis is free. So if any of us is experiencing any of the symptoms that he mentioned, let's do well to get tested and get treated. So, Doc, patients who live with tuberculosis, like many other infectious diseases, often face a lot of stigma from us as community members. What can we do as community members to support people living with tuberculosis? And what is your message for us as Ghanaians on today, the World Tuberculosis Day?
Thank you very much. So, tuberculosis is one of the most highly stigmatized diseases, and the stigma affects people's compliance to treatment and people's ability to come out and get tested or diagnosed. So, I will call for all of us to stop stigmatizing persons who have been diagnosed with tuberculosis. We need to give home based support and care for persons when they are diagnosed with TB. And for prevention, if you are a contact, a household contact of a person with tuberculosis, you have to accept and take the TB preventive therapy to block the transmission of the disease to yourself. That is a way of protecting yourself. The World TB Day is a day that we want to set aside to raise awareness about the fact that TB is curable and preventable, and the services are free. So, my message is that I encourage everyone, communities, healthcare workers, government authorities to come on board and support the National Tuberculosis Program to bring an end to the disease by 2030, aligned to our global targets and engagements across the world. Thank you.
Thank you very much, Dr. Ziem, for sharing these insights with us. We are very grateful for your time. We would like to see you another time on the Good Life chat room. As we commemorate the World Tuberculosis Day, let us remember that TB is preventable and curable. And let's also remember that early testing and treatment saves lives. If you have a persistent cough or any of the signs and symptoms we discussed earlier, please do well to visit a health facility. It can be private or it can be public. Get tested and treated for free. This has been the Good Life Chat Room. Follow us on all our social media handles at Ghana Health Service and Good Life GH for more tips and updates. Leave your comments and questions in the chat box below and we'll be sure to get back to you. Until then, good life, live it well. Good life is an everyday thing. Bye bye.